Splash Medical Devices was founded by a pediatric emergency room physician whose goal is to make treating your patients more effective and more efficient. We make a full line of irrigation products that are used to treat wounds, eyes, abscesses, noses, and ears. Today, I'm going to talk to you about the SplashCap. This product is used to irrigate lacerations. It is simply a cap that fits onto standard size or brand saline bottle. What's really nice about this product is that it goes direct to the source of saline, and you can deliver a high volume of fluid of at least 8 pounds of pressure to a wound in a short period of time. So I'm going to show you the stream of fluid. It's fast, and it's at least 8 psi. So this is a 500 milliliter saline bottle, and within about the next 10 seconds, you are going to see me deliver approximately 200 milliliters of fluid to the simulated wound. Now I'm going to demonstrate irrigating a wound with an irrigation shield and a syringe. So the first thing you need to do is fill the syringe and then attach the shield, and now deliver the fluid to the wound. That took about 15 seconds to deliver 20 milliliters of fluid. So let's try that again. So I just delivered 40 milliliters of fluid in about 30 seconds with this method, when I was able to deliver close to 200 milliliters of fluid in 10 seconds with the SplashCap. That's a big difference, and as you all know, time is money in the ED. We have an irrigation cost analysis model to help you demonstrate to your facility the time savings, which equates to cost savings, of using the SplashCap versus an irrigation shield with syringe in your hospital. Not to mention the fact that there's even more motivation to get people out of the hospital faster. Please ask your local sales representative to provide you that analysis if you're interested. Now let's look at another method used for wound irrigation in the ED, a syringe with an IV catheter tip. Again, I'm going to fill the syringe with fluid, place over the simulated wound, and deliver it. Look at what a mess it makes. There's absolutely no protection for you from any sort of splashback. Here's yet another common method for irrigating wounds, poking a hole in the top of a saline bottle. It's dense plastic, and it's difficult to push a needle into. And as you know, sometimes you, the healthcare worker, will end up, unfortunately, poking yourself, getting a needle stick injury, and then requiring treatment. Now you're injured. Your patient's treatment time has been delayed. And that's not good for you, your patient, or your hospital's patient satisfaction scores, which we all know can affect reimbursement. The second problem with this method is that the holes that were made with this needle are so small that it's difficult to generate 8 pounds of pressure. And again, there's no protection from splashback with this method. So the harder someone squeezes, the more PSI you may get, but the bigger the mess you're likely to make. So most of you won't squeeze the bottle hard enough to generate close to 8 pounds of pressure because there's no protection from splashback. You can imagine that if this were a bloody wound, what a mess I would have made, and how risky it would have been for you, the healthcare worker, to irrigate it without protection. Thank you for taking the time to learn about the SplashCap. It's convenient. It connects to standard size or brand saline bottle. It's fast. We showed you that it's faster than a syringe with an irrigation shield. and it offers protection. It helps protect you from any sort of splashback. For additional information on the SplashCap, as well as our other products such as the eye cap, abscess cap, schnozzle, and ear cap, please visit our website at www.splashcap.com. Stay healthy and stay safe.